And with that, we go to the next panel on investment and funding. So I will invite Damari, who is our focal point technical officer for CRO. It's not Damari, it's not me, obviously. We don't look very much alike, so people won't confuse us. So Damari is technical officer at the WHO regional offices in CRO, and she's our focal point for public health laboratories and genomics and everything we do in IPSN.
Thank you, and good morning, everyone. Happy to facilitate this panel discussion where we're going to discuss investment and funding approaches for sustainable pathogen genomics. I will invite everyone to please give us your full attention. I know your emails are important, your devices are important, but we've got 30 minutes lined up with 3 excellent speakers, which I will now invite up to the stage. So I would like to invite Estée Török, who is the Senior Program Officer in Malaria and Global Health at Gates Foundation. Natsuko Imai-Eaton, who is the Research Lead in Epidemiology, Surveillance, and Sequencing Research Investments in the Wellcome Trust Infectious Disease Strategic Program. And finally, Renuka Gadde, who is the Senior Strategic Advisor for Global Diagnostics at PHA4GE. So thank you, everyone. And as I said, we have about 30 minutes. It's a very short session, but a very important session. So please do have your questions lined up for us at the end of this session. I'd like to start off with some reflections of what I heard from some of the speakers in day 1 and day 2 that really reflected this perception of a lack of interest to support long-term investments in bioinformatics and capacity building, this need for this ecosystem where we may need 2 things coexisting at once, the need for autonomy, the need for sharing and collaboration, and then the need for supporting systems building as well as generating an environment to promote innovation and not having one trump the other, as well as looking at what are the roles of donors and funders and our operational partners to sort of support this ecosystem. So I will invite you to reflect on some of these as we go through our session this morning. So I'll start off, Estée, with you from Gates Foundation. And, you know, a lot of us are really working hard towards building this sustained cross-sectorial genomic infrastructure. But our funding is very much still vertical, disease-specific programming. What can we do to better support this coordination amongst our partners to really break this thinking amongst the donors and this sort of type of vertical structure so that we're really moving towards long-term investments?
Great. Well, thank you very much for asking me to participate in this panel and to give some perspectives from our point of view. So first of all, I think the most, you've raised this already, it's very important to have multilateral initiatives such as the Funders Forum for Pathogen Genomics. We actually need to be able to map all of the funders that are out there, because I've certainly learned that there are other people funding quite significant amount of pathogen genomic sequencing work that I certainly wasn't aware of before I came. And the reason to do that is obviously to avoid duplication of effort and inefficiencies. We need to leverage existing networks such as the Africa PGI and Asia PGI to build long-term sustainable capacity in national public health labs. We also have a number of bilateral initiatives such as collaborations between the Gates Foundation and the Wellcome Trust and the Gates Foundation and EDCTP, which we have worked on in the past. And then, as you've mentioned, we need to fund across disease verticals, both within the foundation, which we have started to do, so we have some collaborations between the malaria strategy team and the genomic epidemiology teams, but also outside. So with CHAI and with the Global Fund, we need to think about, rather than vertical disease programming and funding, we need to think about how can we do more horizontal and integrated funding. Looking longer term, one of the things that I've done is I've built a lot of genomic sequencing capacity, both in academic labs and in national public health labs. And we need to think about transitioning routine for example, malaria molecular surveillance from academic labs into national public health labs, and adding budget lines into national strategic plans. And then finally, in terms of sort of more innovative financing, how do you explore multilateral, for example, development bank funding to fund things like wastewater environmental surveillance, include genomic surveillance in domestic government budgets, and explore local, private, and public partnerships. So I don't think there's one big solution. It's a question of mapping the funding landscape, identifying synergies, and identifying long-term sustainable solutions.
I wonder if I can ask you to just expand a little bit on how we move from vertical to horizontal, and if you can share some of your experiences of maybe some lessons learned in your approaches for malaria genomics, and how this has impacted more broadly.
I think what we've realized is I've looked at the investments that some of my colleagues in the foundation have made, and there's a lot of synergies between what we're doing in malaria genomic surveillance and what they're doing in pathogen genomic surveillance more broadly. So if we can co-invest in an organization or in a network, we get economies of scale, actually, rather than having two independent investments that duplicate effort, and so that's one way to do it very strategically. I think in terms of the Global Fund, obviously they provide funding to countries for HIV, for TB, and for malaria, but and all of those probably have genomic surveillance within them, or a need for genomic surveillance within them. So can we give countries budgets for their laboratories to deliver that genomic surveillance across 3 diseases, rather than, we'll give you a little bit for malaria, but we won't bother about the others. So I think, when countries are preparing their funding applications, they need to sort of put in a line for genomic surveillance, and it needs to go across diseases, not just for one specific disease.
So I think that,
and likewise with CHI, I think there's CHI malaria, CHI HIV. We need to think about how across CHI one can work together to support. But I shouldn't really be speaking for CHI. But is there a way that within technical support agencies that they can also think about horizontal programming rather than vertical programming?
So what would you say would be a key point to say to donors, start thinking this way? Because it shouldn't also come from the ground up, right? It should also come from donors themselves having this sort of thinking and moving it.
So I think donors are waking up to this, and we're certainly proactively thinking how we can engage with other donors in this space, because obviously we don't want to be on the hook for funding genomic sequencing forever, and we need to think about how do you diversify funding streams but also make them sustainable.
So maybe expanding on that, we do see some of our funding also being framed around pandemic preparedness or pandemic response. And Natsuko, I'd like your perspectives on this from the Wellcome Trust and their view on really promoting this sense of integration and sustainability, and how you're doing this within the scope of your funding.
Yeah, sure. So thanks very much, and thanks very much for having me on this panel. So I just want to say I am indeed from Wellcome and not from the Robert Koch Institute that was on the slide. And so for those who are less familiar with Wellcome, we're a global charitable foundation based in the UK, and our mission is to support science to solve urgent health challenges. And we have 2 arms in our strategy. One is solutions, so we invest in applied research, which focuses on much more short to medium-term health impact. And that's where I sit within the infectious disease division. And then my colleague Ekin, actually in the audience, she sits in discovery, and they fund more curiosity-driven research, which has sort of the potential to improve human health, and then also the broader research ecosystem. And so in terms of pathogen genomics, as a research funder, we fund research that may improve genomic surveillance. We may fund projects that use surveillance data for public health decision making. And then we also invest in the enabling environment. So that would be sort of data infrastructure, workforce, policy engagement. And then, Damari, to your question, I think in terms of making the case beyond emergencies, I think it's really about repositioning genomics as a tool for routine public health and not just for emergencies. And I think we've heard a lot of that over the last 3 days. And the previous panel also spoke very clearly about this, and also the importance of it aligning with national strategies. And this will really ensure the relevance locally and strategically, politically. And I think, the work that IPSN, PHA4GE, everybody in this community is doing in terms of demonstrating the use case is really so important. And it really shows how genomics can support routine disease control. I'm going to give two examples, just from a Wellcome perspective. So one is our major international programs in SIDRI Africa Genomics Consortium. So during the pandemic, we supported our major international programs, and many of you in the audience will have been involved, as well as our discovery platform in South Africa, to build SARS-CoV-2 sequencing capacity nationally. And this was really the first time that all of the sites had come together to work on a single pathogen. They had a sort of shared scientific plan, a data analysis plan, and that really allowed them to not only increase sequencing capacity in country, but provide national insights, regional insights, intercontinental insights. And this really demonstrated the policy and the health impact. And so for Wellcome, we were able to say, this is demonstrated impact, and we should think about, okay, how do we build on this investment that we've made? And so we've refunded the consortium. We gave them a pretty hard ask to not only align with our, internal strategy, and every funder is governed by some kind of strategy internally that we have to answer to, but also to address their local priority pathogens. And so, across 2 continents, that's quite a difficult ask. But now they're looking at TB, Klebsiella, dengue, and chikungunya. And not only that, we were able to supplement that grant for them to look at H5N1 preparedness. And so I think this really showcases genomics as sort of this pathogen-agnostic tool for integrated surveillance. So that's one example. The second example, and I'm going to be brief here because Nikki Mulder in the room and Ekin can speak much more about this, but this is the African Bioinformatics Institute. So it's co-funded with CZI, and it's really to build bioinformatics capacity and infrastructure across Africa, and really to be shaped by the needs and priorities of the community. And in terms of the funding model, it's intentionally small and catalytic, but with this co-funding built in. And so I think this is sort of a plea to the community that it is now up to you to really demonstrate the value of this kind of investment to help secure more longer and sustainable investment. And then I'm going to wrap up. So just in terms of my key messages here, I think ultimately as a research funder, we can only really provide short to medium term funding. That's the nature of the research project. It should be hypothesis driven, and then you kind of move on to your next hypothesis. But if you're thinking about putting in a research proposal, from the very start, think about what is your research uptake pathway. So how do you demonstrate from the beginning how your research can help address your national priorities? How can you showcase the use of genomics? And as I said, I'm just going to reiterate that I think truly sustainable infrastructure and healthcare or health system strengthening can really only be done from the government level. Mm-hmm. I'll stop there.
Great. I think that's a lot of very interesting projects ongoing, and good to see the breadth of pathogens that it covers. So we have a lot of researchers in the room and a lot of institutions in the room. What would be some of your advice on some of the more persuasive arguments they can use to the donors so that they see the value in investing? You've mentioned the tools, you've mentioned the use cases and addressing the national priorities. Can you expand a little bit beyond that? Because I think if we reframe genomics and the utility of genomics, then the access to different diversified funding may open those doors to us. So what do you think could be some of those arguments we could use?
So I think maybe just to give a kind of specific example, we have sort of a portfolio still of COVID funding. So it's really looking at biological significance of the SARS-CoV-2 variants. And as we all know, thankfully, sort of there's not much COVID to be sequencing. And so what those teams have done have been to use that funding very flexibly, and I think that is one of the advantages of Wellcome funding, is that we are, generally speaking, quite flexible in how the funds can be used. And so particularly our Okru site in Vietnam, they've used that platform to pivot and sequence the Mpox cases that they detected and demonstrated that there was community transmission. And they have a great link with their policymakers, and so they could tell us then, like, this is the impact that our investment has had. It's informed how that community transmission and the control measures have been implemented. Also, they've used it to look at, H5N1. They've also used it to address hand, foot, and mouth disease in country. And so I think it is really just demonstrating that flexibility and that almost kind of that return on investment of, you may fund something that is quite specific, but actually look at the added and not written into the application impact that you can have.
Okay, so having a very strong narrative with some demonstrable examples. Okay. So I think we've also heard about the mention of innovative financing mechanisms. I'm going to turn this to you, Renuka, to maybe tell us a little bit about what opportunities are out there where we can explore these sorts of mechanisms. It was also very well expanded on in the presentation from Francis. So from your perspectives, what is out there that we can be implementing to help us support with sustaining our pathogen genomics systems?
Thank you so much, and thank you for having me on the panel. My insights come from a project that CHA is working on, funded by the Gates Foundation, that's looking at both the impact of Africa PGI and how do you strengthen procurement and supply chain. So we did this work, we're doing this work, it's an ongoing project in 6 countries in sub-Saharan Africa. And no surprise, just as Francis outlined, key top concerns among the national labs, public health labs, are lack of funding, lack of bioinformatics infrastructure, really delayed, prolonged customs duty costs. In some countries, believe it or not, it's as high as 40%. I'm not talking about the associated delays, but just the additional cost. And how do you streamline and strengthen the service maintenance contracts for the instruments placed? So we started doing a deep dive in understanding some of these. And unlike molecular diagnostics or HIV testing, the volumes in sequencing, as you said, for research will always be short term. And if you sequence about 5 to 8%, you almost always get the answer. So you don't need to sequence every test, right? So this is, I'd say it's not a volume game like molecular diagnostics, but it's high value. So in that context, how do you look at innovatively sustaining financing and funding? It's a different ball game than your routine market-shaping interventions, I'd argue. And so from what we see, we think there are interesting opportunities. One, both at the donor level, where you already spoke about how do you coordinate, collaborate. And you were speaking about verticalization. I'd go a step beyond that and say some donor funds restrict labs from applying the funding towards hiring bioinformaticians, or you can't use this fund for paying your supply chain costs. So it's very restrictive funding. So even before verticalization, to make funding flexible that can enable the institute perform effectively is one intervention. Then of course, looking at horizontal and leveraging the work across donors to gain that volume, which otherwise in a very fragmented setting, it would be very hard to intervene. But we're also looking at, when we did our survey, yes, the countries are developing their national plans and strategic plans, but to date, we haven't seen a national budget line for sequencing in these countries. Until you have that in your national budgets, plans remain plans, and they're wonderful plans, but how do you move forward? But we're also looking at some innovative interventions. Could we look at streamlining the service and maintenance contracts. In a particular country, in the same country, two different labs, there is one lab's paying X and the other lab is paying 4X for the same equipment for service and maintenance. So there is a need for suppliers to kind of streamline that offering. We found some innovative examples in Uganda where the government of Uganda does not take the responsibility for supply and maintenance at all. They pass that on to Medicell, their distributor, who does every viral load procurement for the government. And so consolidating all your procurement through the distributor then takes the responsibility for service and maintenance, which is a very unique model. Haven't seen that in other countries. But a combination of donor harmonization, national budget lines, and then looking at incremental strategies such as, I see Daniel Bridges here. Can we look at creating bundles in our workflow process? Daniel was talking to me yesterday about how during COVID, ONT offered the midnight bundle, which was very, very good. Could you do that and extend that to malaria? And so we're working on, can we pilot that? Those will be incremental, small innovations, but one of the other innovations we're looking at is, can we look at establishing local manufacturing? And I think when we were speaking about COVID, and I remember your group, I think, was really advocating for always ready on facilities to make sure that in the event of a crisis, of an outbreak, you're having that capacity locally. So we're looking at, can extraction kits be made locally, procured locally? What about lab consumables, or exploring aspects of nucleus-free water in the public health sector that's not available today? So I think it's those incremental innovations that you're looking at in this space, given that it's not your high volume continuous. And as you expand beyond public health into routine and into other disease states, maybe that volume will build, but we're right now in the process of piloting some of these programs. I don't know if that answers your question.
It's a lot of answers, yes. It gives a broad perspective, and I think we haven't really discussed the maintenance, the real background of what makes a lab run in this context over the last few days, but I think this is important to think about. We did have a discussion in our working groups where we thought through procurement and supply chain and the role of customs, and it came up in our earlier morning session. So what do you think could be the role of the IPSN community and this community to take up some of those innovations? How do we get the message out there? How do we facilitate this? What are some of your recommendations to the IPSN to think about this?
Yeah, I think one thing that, if I look at IPSN and the leadership role that you've played in not only putting out use cases there, your strategies there, one area that we've been advocating for is Donors Forum, which is not just comprising of donors, maybe I shouldn't call it the Donors Forum, but a forum where you're bringing the donors together along with some of the implementing partners, advocacy agents, and maybe governments to really get a visibility of what could be that 3 to 5 year horizon. Because beyond that, I think every research projects vary and surveillance projects vary. But it forces the research to talk to surveillance, to talk to beyond surveillance and outbreaks to routine, and then understand where that funding is coming from. I would say learning from the lessons of today in global health particularly, having the national governments to say at what point would you start putting something in your budget line, so building in sustainability from the very front. I think organizations such as ISPN or CHAI for that matter, we become that consortium, if you will, that would look at visibility from top down, bottom up, and force some of these challenges and policy discussions, because some of them are within our control, some of them are definitely within the supplier's control or the government's control, and the donor's control, right? So how do you bring this community together intentionally to act upon solving some of these challenges that are repeatedly surfacing no matter who's doing that work. We hear the theme, so how do you address them? I'd say creating that intentional consortium, call it whatever, but a combination of the key stakeholders, and maybe start small and scale big, but that could be a good place to foster some collaboration that's unusual or different from what's already happening, and the fantastic progress. And all of this, not to forget that when Francis was saying from 7 to 46 countries in less than 5 years, I don't know of any other initiative that could have scaled that fast and that quick and that efficient. We're talking about Africa alone, right? I'm not even looking at the Asia PGI, which is in its own right, yet another force out there. So I think the opportunity for that collaboration exists, and maybe that needs to be actioned.
And I think something for our networks to take up as well to facilitate. So thank you. I think I'll pose the next two questions to Estée and Natsuko, following on from this of what can the IPSN community do to generate the evidence that is needed to shape the donor engagement, the requests to move towards that longer term investment that we need? What can we do to reform this, to reshape it so that we're communicating in a different way and really highlighting the value of investing in genomics?
I mean, I think some of the points have already been made, both by previous speakers throughout the conference and on this panel. But I think, the development of national genomic surveillance strategies with priority pathogens defined, not just we want to do everything everywhere, and costed business cases and budget lines. Because you can, at the moment, there can be a wish list. We want to do everything everywhere, but actually if you can't afford to do everything, you've got to pick, your top priorities and find a way to fund that. And you need to have basically some sort of low-level sustainable funding to do your routine surveillance, but also have contingency surge funding to investigate outbreaks or novel pathogens. Again, linking up syndromic disease surveillance within national systems to identify early identification of outbreaks or novel pathogens, and then enable very rapid sequencing. So Placid Mbala gave a lovely talk on the first day, and even he showed that, once he gets a sample, he can sequence it and analyze it super fast. But if you don't send him the sample for 2 or 3 weeks, actually the epidemic curve has got away from you. So it's how do you sort of link the epidemiological surveillance early warning system with rapid genomic surveillance so that you can actually, institute interventions. I think one thing that might be worth considering is adding pathogen genomic surveillance to national risk registers, because once it's on the national risk registers, the politicians and policymakers have to look at it every single day, week, month, whatever, and pay attention to it. Whereas if you kind of think, well, it's a nice to have, but it's not something that we're really worried about, you don't plan for that. And then finally, I think it's really important to do some health economic assessments and modelling of the costs of routine surveillance versus outbreak response to inform these investment cases. So, my previous life, I was a clinical academic, and we did exactly this kind of work, doing routine genomic surveillance in hospitals, and you showed how much one outbreak of a multi-drug-resistant Klebsiella could cost you versus what it would cost you to set up a routine surveillance in your hospital, and it was a lot cheaper. So those are a few thoughts, but I'll pass on to Natsuko for some more.
Yeah, thanks very much, and agree with everything that Estée said. I think, some of the work that IPSN is doing on, thinking about what is, for each country or what use case, what is the next best investment? I think that's a really important kind of framework for countries to think about, okay, with our limited resources, what should we be investing in? Totally agree in terms of the cost effectiveness. And I think it's UKHSA, I might be speaking out of turn, but I think UKHSA had some very nice case studies looking at when they switched over to whole genome sequencing. This is how the workflow changed, and this is how, both in terms of human capacity and money needed, the budget needed, these are the gains that were made. And I think having that very clearly laid out is really, really helpful. And then I think just in terms of the kind of IPSN question, also saying, what is genomics actually not useful for in this particular context? I think what you should use it for and what you shouldn't use it for, I think having those two things very clearly laid out is really important. And then maybe just from a research funder perspective, the IPSN Catalytic Grants Fund, and I know we'll hear more about that this afternoon, that's been really helpful for us. It was, that initial pool was co-funded with Gates, Wellcome, and Rockefeller, and I think individually they were relatively small investments, but being able to demonstrate actually, put in a little bit of catalytic funding and look like the impact and your return on investment is much broader. And I know now that there are other funders now, putting funds into that pool. And I think what's really nice about that Catalytic Grants Fund is that every project is supposed to address and articulate how does their project address national country needs. And so I think all of that will hopefully build towards, how do we make sure that the right genomic surveillance or the implementation of sequencing is appropriate and suitable for each country context.
Yeah. And please continue funding that catalytic grant, because I think it's had quite an immense impact. And I would ask everyone to go to those posters and have a look at that and speak to our awardees that are here. We have some really great feedback from that. So that's a good start.
Yeah, I was just going to add, I think listening to both of you, some other thoughts in my mind. So in the current landscape, given the scale back of Fleming Fund and the whole Seek Africa program now under some threat, and you're talking about Class PLI and AMR and the context of doing a cost effectiveness, I think that would become number one if there was a way to kind of say, make an argument of why that needs to be done, and to look at then how do you fill this gap with whether that's other philanthropy. We found that there are 30 unique donors in this space, so how do you get some action mobilized in this space? And oftentimes funding from Gates or Wellcome Catalytic really sparks a larger call to action. So I think that's very interesting. And I really liked what you said in terms of what not to do so that you take away that redundancy and waste in the system, which can be which is as important, I'd argue. And I think the role of ISPN to really put that, IPSN to put that out there for people to kind of use as a guideline or a reference could be very, very interesting. And in this whole consortium that I was talking about, the visibility to what donors would do can also then lead to what is that scale that you can expect in terms of volume that can lead to further negotiation with suppliers, because I think Francis made a point to say the cost of doing genomics in Africa is much more than elsewhere, and it's that visibility of that volume that could also be something that we could work towards, maybe. Thank you.
Excellent, thank you. So it feels like a bit of a rushed discussion, and I apologize for that, but we are out of time, and I would like to turn to the audience to see if we do have any questions for our panelists today. We had a lot of interesting ideas coming in, a lot of discussions on different financing mechanisms. Yes, Emma. Please, let's try to just have a little bit of a longer discussion and then take this also into the working groups later today.
So thank you so much. This has been such an insightful panel, and I really appreciate kind of the thoughtful responses and also kind of attacking this from many different angles. I'm going to go a little bit specific, of course. I won't hide. I have a vested interest here, of course, with my pathoplexus hat on. I think it's really great that funders, I think especially in the last few years, have been starting to really emphasize the importance of not just the data generation, but also making sure that we share that, making sure that it lives somewhere so that it can be reused and the most can be made out of it. And I think a lot of funders now have this often as kind of a condition, that the data is shared in some form or fashion. But I think that we still are lacking, and I know I'm coming back to a common theme of the program, how do we do this sustainably? And how do we then fund this? Because as has been mentioned, a lot of the focus is often on getting things going, new programs, but not funding a database forever and ever, which I completely understand from the standpoint of especially the funders that are here today. One thing that we are definitely aren't so interested in with pathoplexis, for example, is charging for access, because there's so many problems with that, especially given the disparities between different countries and the fact that we all know public health, unfortunately, is a boom and bust cycle. Sometimes we have a lot of attention, usually when there's something terrible happening, and then sometimes there's no money at all because we all got bored of infectious disease. One thing that we've talked about is potentially having options like, could people write into a grant that if they plan on sharing their data, I'll use pathoplexis as an example, on pathoplexis, that if they're writing a £2 million grant, they could put in 10,000 that goes towards maintaining the database that we aim to use. And I'd be really curious about what thoughts are about that kind of sustainability, where it's being built into the research that, number one, says they're going to use it. So, for example, if pathoplexis becomes not so good, people would just stop writing us into grants. So it would be kind of dependent on us convincing people that we're useful. Or if there's other options that you guys have thought about or have heard about for how can we make sure that databases, and not just pathoplexis, others as well that have struggled to stay up, struggled to stay updated in technology, for example, has been a big challenge, that we can make sure that there are still places where data can be shared and accessed in the future.
Thanks, Emma, for your question. So I think to your question around can that sort of budget be written into a grant application, speaking from a Wellcome ID specific perspective, I think certainly. I think that's a great way to make sure that you are also demonstrating you've thought through where are your data going. And in our application forms, we have a very clear section on output management plans, and we would expect to see, these are the data that we're going to generate. This is how we want to share it, and therefore this is the budget needed. And for me personally, I would very much welcome that, and some of the reflections that we've had from our SARS-CoV-2 sequencing portfolio has been, where should those data go and sustainably, and certainly that portfolio, it was the first time where we wrote into our grant conditions where the data should be going. So usually we just have sort of this open access policy, it's quite generic. But here we said within 6 months, it must be submitted to some kind of open access platform as well as a parallel platform. But I think maybe just the counterpoint to your question is certainly write it into your grants, but then another question would then become, okay, well, what happens if it's a little bit of funding here, a little bit of funding there, and I think this isn't really an answer to your question, but I guess it doesn't fundamentally, it helps, but it doesn't fundamentally address the problem of really long-term sustainable funding.
And, I agree. I mean, it's fine to write these sorts of things into your grant applications, but one of the things I think we have to fix is the ability to upload data into openly accessible nucleotide archives, and make that easier, make it easier also for people to access it, and also for people to amend it or correct it if it becomes incorrect. So I think there's obviously collaboration between NCBI, ENA, and the Japanese Nucleotide Archive, but and that's a great step forward. But I think making it easier for people to upload data and download data and correct inaccurate data, I think is super important, and probably something that we need to think about a bit more.
Thank you. So unfortunately, I'm going to have to bring this to a close, but fantastic discussion. I think key message here is make sure you have a budget line in your national policies everywhere, advocating for this, and to the donors and funders, please keep funding our developers, our implementers, and our catalytic fund. So thank you, and please continue the conversation over, what are we now, at coffee break and in the working groups later today. Thank you.